Good stuff. All right, well, welcome everybody, and thanks for joining us for our April 2021 Cascade ASSP chapter meeting. If it's your first time, welcome. There's plenty of excitement and wonderful knowledge coming your way. A few things before we get to our presentation today is a little bit of chapter business, and that is Jim, Naomi, and myself were able to attend the Rock recently, and a tremendous amount of information. It was really well run between all the participants and hearing from the other chapters, and everybody's got the exact same struggles that we do. So it was somewhat of a empathetic, validating celebration of all of the things that we've been experiencing for the last year. And we'll have more information to share. I'd like to do a recap, maybe whenever we have an opportunity, perhaps our next meeting, when we have a little bit more time. I know we have a huge topic today, but just a couple things to call out. We need to square away our officer elections. So a couple of things that are in place already. Jim will be moving into the president into our next year, and a number of positions are available. And I think everyone's at a point where we can consider if you want to shadow a position for a year, or you want to kind of do a soft move into a position. But there is a call for nominations. Essentially, that's what we're at. So we want to see if anyone else would like to nominate anyone else for a position, or if you would like to take a role yourself. I know we talk about the struggles that we've experienced, but if you've been part of our chapter for a while, you can see that we've had quite a bit of success, even in these challenging times, that we've had a great program with our program coordinators and fantastic communication and collaboration, and specifically our meeting last month where we got to do our kind of meet and greet with each other, the social event. So it can sound a little intimidating because we're like, oh, it's so challenging, but it is really rewarding, and it's not really overwhelming. We've got a great chapter officers that are all here to support each other. So just advocating excessively, because your participation would be fantastic if anyone else wants to be involved. And those are due by the 31st of May. So we're gonna have to get on top of those. We may have to consider some additional communications throughout the month to hit that target. But just know that if you get contacted by Jim or myself or someone else from our officers, that just exploring if you might be up for participating a little bit more. All right, without further ado, I'll turn it over to Jim to introduce our speakers.
Yeah, and Dennis, maybe on that last topic, if for folks who are interested in either thinking about or want to nominate themselves or somebody else, Dennis, maybe if you'd put your email in the chat, and you can put mine too. Mine's just Jim Nuss at SAIF, and I'll do that after I do the introduction. That you could reach out to either Dennis or I would be great. So with that, today's topic, what occupational health and safety professionals should know about total worker health. We have two speakers today, Dede Montgomery and Liz Hill. Dede has many years of experience working as an industrial hygienist and safety and health professional. For the last 15 years, Dede supported the Oregon Institute of Occupational Health Sciences outreach and education programs to provide IH technical expertise to its research. She's also, the outreach and education director for the NIOSH-funded Oregon Healthy Workforce Center, and has an MS from University of Washington, and is a certified industrial hygienist, and is currently involved in the Columbia Willamette chapter of ASSP, and will be the president of that chapter starting this summer. Liz Hill is a fellow coworker of mine at SAIF Corporation, and Liz has many years of experience as a professional in the health and safety world of things, working at SAIF. Prior to working at SAIF as a safety management consultant, and now as the Total Worker Health Advisor, Liz worked in a variety of industries from oil and gas to higher education, and has a master's in public health from Oregon State University, and is also is a certified industrial hygienist and a certified safety professional. And so with that, I wanted to welcome Liz and Dede today. And thank you so much for joining us, and turn it over to you, Dede.
Great. Thank you, Jim. Great to see you virtually. Liz and I, interestingly enough, the last time we did the Total Worker Health 101 in person was in your neck of the woods at the Cascade Conference a little over a year ago. So we have been doing this virtually since then. It's great to be here, and I think I'm learning about Teams where I can't see the chat, but Liz can, since I'm sharing the screen. So we'll make this work. I'll go ahead and
let me jump in with one other plug before you jump in. So one of the things I intended to do in the introduction, Liz and Dede are doing our discussion today, which will end by 1 o'clock for folks. But they are coming back to do a session that we are co-sponsoring with the Southern Oregon chapter of ASSP on the topic of total worker health. That will be a 3-hour session on the 12th, and it will allow people to get CEUs, and so if you need that, you can attend. The other part of the reason why we wanted to have this topic today, the shorter version, was that, at least from my perspective, sometimes it can be helpful to not only have the safety professionals, perspective on this, but aligning that with the perspective for, say, the HR and the benefits, because oftentimes, in my experience, the folks doing the safety work are in a different department than the others. And so if you find today's topic helpful, we thought that then would give you enough time to potentially invite some other people in your organization to attend, which might then give you kind of the opportunity to get everybody on the same page as you work related to total worker health initiatives. And so, Dede, I don't know if you want to speak a little bit more about the 12th, but I want to make sure that didn't get missed. Thank you.
I appreciate it. I was going to do that if you didn't. So thanks, Jim. I appreciate it. No, it's great. So what we're doing today is, as you can see in here, it's less than an hour, kind of an introduction to total worker health, of which I know many of you already have a fairly good sense about total worker health. What we don't want to do is duplicate what you would get in the 3-hour. Certainly we can't do that in 50 or 55 minutes. But we want to give you a sense of what you would get out of that. And Liz can jump in after I say a couple more things on that. What we're going to talk a little bit today, and you can actually see on it's prettier on our first slide, that logo on the left-hand corner, the Oregon Total Worker Health Alliance, of which we thank our friends at SAIF for always helping us create things that look better than what we could have created in the kind of logo department. But our alliance, we might as well mention now, which is about, a number of years ago, 3 of us in Oregon, so SAIF, the Oregon Institute of Occupational Health Sciences, where I work at OHSU, kind of representing the academic center, SAIF kind of representing the state worker comp provider, and Oregon OSHA. We sat down together and we realized we were all talking, especially SAIF and our group, we're talking quite a bit about total worker health at various conferences. And we all support the same cause. We may not look at it exactly the same way, but we support the concept. And so the thought with this alliance was, let's work together on this. And maybe one of the first things we can do is develop a curriculum that is really represented to be useful for particularly safety and health professionals, but as Jim said, also kind of that rest of that integrated team, which we have HR and risk management and operations and on a whole slew of potentially other folks that might have something to do with total worker health. And so our thought really with this training is, let's start it with a 3-hour class. I know you did think I would come back to that. This 3-hour Total Worker Health 101, the basics is what we've been calling it. And we did teach it live, probably, 6 or 7 times before the pandemic hit. And we've now taught it virtually 3 or 4 times. And it's really going pretty well. And so Liz, do you want to kind of jump into that a little bit before we kind of go hit a little content?
No, I think you covered it. Thank you, Dede. It's really important. I think well, one thing I would add is it really sets us apart from other states. We're the only ones that currently have this alliance, and it just really helps us get perspectives about total worker health and how we can help implement it in this state.
Thanks. And we are fairly familiar with what's going on nationally. So you'll see in a minute with our Total Worker Health Center where I work. But in addition to that, I've sat on a Total Worker Health task force for ASSP in its first couple years that it was around. And then more recently, I moved to the ANSI ASSP standard development for total worker health. So looking at a management standard for total worker health. And Liz has been really active in the task force for AIHA, also looking at total worker health. And we'll get a little more to why those organizations matter in a minute when we talk about affiliates. But we would certainly welcome the City of Eugene and other partners who are moving towards that interest in affiliate status. So what we're doing today really is defining total worker health. We really believe it's critical above all else, whether you take a 3-hour class or a 10-minute class, as we start to use that language. And it certainly is a registered trademark now within the federal government that we talk about the same thing. So we're certainly going to do that. We're going to define mention what the 5 defining elements are of total worker health, but we're not going to go into the detail, the level of detail that we would go, obviously, in the 3-hour class. It's a pretty big part of that, and it gives us the sense of, well, what does that mean for our organization? And then finally, a little bit about how organizations can implement total worker health. And we're kind of relying on some of you in the short time we have today to maybe share some of those ideas in just a bit in the chat. I will just say the 2 things I always say, though, as we kick off, which is what we've learned and what we continue to learn is there is no one size fits all for total worker health. And nobody's doing it all right now. We're all it's an evolution. We're on different paths and there's different ways to go about it. So this is not at all to talk about this prescriptive way to do safety, health, and well-being within every organization. And it's also not about how a safety professional has to do every part of it. We are opening up our eyes to it and understanding how we work with others in our organization.
So let me talk a little bit about the NIOSH Total Worker Health Affiliate Program. And one of the things that I always like to say here is that the affiliate program is only open to certain organizations, nonprofits, higher education, governmental agencies, and the like. However, I really want to emphasize that the concepts and ideas and elements of total worker health, it doesn't really matter if you're an affiliate or not. You can certainly implement all of them. And I know many for-profit organizations that do total worker health and they just call it something else, but they're really taking the ideas and concepts that we're going to talk about and applying it to their for-profit business. So just keeping that in mind. So the affiliate program is really, like I mentioned, those organizations that have agreed with NIOSH, who administers the Total Worker Health Program for the federal government and CDC, that they will do certain activities, that they apply total worker health principles and practices for their employees. And in SAIF's case, we also use total worker health as one of our primary consulting strategies. So as we're out there working with policyholders, we are talking about the concepts and practices that we're going to talk about today, and trying to really drive that vision of having Oregon be the safest and healthiest place to work. And if you look here, you'll see that there's several professional organizations that are also affiliates. And I just want to shout out to City of Eugene, who's the other affiliate in Oregon. And we have some folks also exploring becoming an affiliate in Oregon. So we're excited to welcome anyone who wants to join the network. But AIHA, which is the professional organization for industrial hygienists, ASSP, we have our occupational medicine professional organization on here, and our occupational health nurses organization, as well as the okay, thanks, Lance. I didn't know if you wanted us to be public with that yet, but eWeb is looking to move into the Total Worker Health affiliate status. So we're very excited about that. NIH, National Safety Council, is another one that's an affiliate. So what these organizations have decided is that, and if you talk to any of the representatives of them, is that Total Worker Health is really the future of what they see for occupational safety and health, but also, as we talked about, occupational medicine and HR. And as we move forward, thinking about, how all of those different disciplines work together to take a look at the total worker and how we're supporting the health of that worker.
Thanks, Liz. And so similarly, but different, the Total Worker Health Centers of Excellence are a smaller group. Currently, there's 6 centers, including the Oregon Healthy Workforce Center, where I work. I know both the long name and the multiple organizations where I work gets very complicated or confusing. And some of you have been around long enough to remember when I would go to the conferences and I was Crowit. And we didn't even tell you what that stood for often in those days. So just because it's important to keep this in mind, I'm an OHSU employee, and within OHSU, I work at the Oregon Institute of Occupational Health Sciences. Many of you know some of our other faculty. We do a lot of research on sleep with Steve Shea's group, and we do a lot of total worker health work around Leslie Hammer, and the FACE program sits in there. So we have about 80 or so folks that work within that group. Within that group is housed the Oregon Healthy Workforce Center. So some of us are also part of the Oregon Healthy Workforce Center. Basically, any of us are working on total worker health related things. All of these centers are recognized. We had to apply, and we were recognized by NIOSH for doing different kinds of things around total worker health. And we have now we are completing our second 5-year funding cycle, which ends in August. If you were around me at all this fall or winter, or any of my coworkers, you might have known how hard we were working to get our application in to try to become a center of excellence for another 5-year cycle, as are not only all these groups, but many others. So it's a very competitive process. I wouldn't say it's a huge amount of money, but it does really target what you are, being recognized for working on. And so what we expect is to know sometime this summer what our chances are of being funded again. And so this is really my opportunity to thank some of you who did write letters of support for that. So thank you for that. We'll keep you posted. I know that's a lot of information, but that's really one of the things that gives us this great opportunity to do the work we're doing in Oregon, which I do think is different than other states, largely because some of our organizations are used to working together. We're small enough that if you work at SAIF, or if you work at eWeb, or if you work at City of Eugene, or any other organization, you're familiar with working with Oregon OSHA. Oregon OSHA is familiar working with us. We have very good, we may not always agree with each other, but we are familiar with each other in a way that has made this a really successful venture.
I just want to add something about the Centers of Excellence. And I sent to Christy and Jim a resource sheet that we've put together that kind of breaks out. One of the things I would say, each Center of Excellence has a kind of a different focus area. And so it's really great to know, as you're looking to implement some practices, where each Center of Excellence has spent their time doing research. And one of their goals, and one of the reasons they give funding, is to really think about how do we take our research and put it into practice. So they all have different projects that they're working on. And, you know, if you want to know about sleep and supportive supervision, you know, we know that our Oregon Center is really working on that kind of stuff. The Harvard School of Public Health Center is really looking at how do you implement this, and really talking about integration measures and things like that. And then we have different centers that are looking at different things. So in that resource sheet that Christy says she'll send out, because I couldn't get it to go into the chat, really breaks down what each center is working on. So if there's something that you are really interested in or thinking, oh, I could use some help and support with that, I really urge you to take a look at the different centers' websites.
Thanks, Liz. That's really important. And I think added to that is really great feedback back to NIOSH that the centers could do a better job of engaging with stakeholders in their area and kind of working more together rather than just doing research, but really doing the research and the dissemination together. And so I think in this next research cycle, I am certain that whatever centers get selected will have that pretty big on their kind of outreach and education, as well as their research side, their dissemination of research. And I think Liz and I would both agree we're excited about that because, you know, the reality is the researchers learn so much from practice. Sometimes it's working together in research, as we often do in our intervention research with our center, but often it's like in these opportunities like today, where we get to hear what other organizations are doing. And, you know, and so much of it does relate to total worker health. And really think about right now, we're going to jump into the definition, right? And, you know, we'd ask you, what does total worker health mean to you? And I think in your chat, feel free to write it into that. Not you probably even know what the technical definition is, but what does it mean to you when we talk about total worker health? It's a term that I think Liz and I just tend to throw out, you know, here and there a lot, even in other conversations.
And I think for me, like, what does it mean to you? And feel free to chat it up. And we understand there may be some people that really have spent some time around not only the term, but the concepts and principles and have a deep understanding. And others that are like, oh, it's the first time I've heard of it. So, you know, whatever occurs to you about when we say total worker health, what does that mean to you? We'd love to see some chat going on about that.
Liz is going to interrupt me when she can start to read some things, but I'm going to add a couple of points here. Part of why NIOSH decided to formally, at first the term was trademarked and then registered, was they don't care what you use to call it, but the point being is when you do refer to something as being kind of total worker health concepts, that it is actually saying what we are all believing is the future, as Liz referred to, right? Versus kind of something that might sit on the shelf somewhere and there's no evidence behind it, or it's not doing entirely what we're attempting to do with total worker health.
Yeah, and I'm seeing a lot in the chat about taking care of the whole person and that reference to both home and work and creating healthy habits or supporting healthy habits at work and encourage workers to or employees to practice even when not at work. And I think those are all really great ideas. And also this idea about the person is more important than production, and that how happy and healthy aspect of that. And we'll talk a little bit more about that too when we get to the what I call the governmenty definition of total worker health.
Liz likes to tease.
This is how I like to think about total worker health. And really, for me, it's really thinking about this concept of well-being. And we heard some reference to that in the chat about healthy and happy. And in our 3-hour class, we spend a little bit more time on talking about what well-being is and how you can measure it, and what are some of the things that we think about when we talk about worker well-being. But one of the things that I like to point out here, and especially when I'm talking with groups like yourselves that are occupational health, safety and health professionals, is that foundational to total worker health is keeping workers safe. So we know if we are working on workplaces that will help create worker well-being, and we are not addressing the hazards and exposures to things they're experiencing in the workplace, and we are not really doing all we can to get to that well-being place. And one of the things that is also fascinating to me, and which I love about total worker health, is we're also broadening what we think are hazards and exposures. So venturing into that realm of psychosocial and stress and fatigue and sleep, and thinking of them as hazards and how can we control them as employers is really important when we're thinking about total worker health. Then the second piece of that really is we're going to grow health. And so probably a lot of you have thought about total worker health in terms of we're kind of integrating or mushing together the safety and wellness so they're not separate identities or even separate initiatives that we're doing in the workplace. But I would like to also expand how we think about that. So when we mean grow health, that means we are putting in place things in the workplace that promote the health of the people that work there. So it could be, like I say, something very simple, such as healthy nutritional support, doing away with those donuts in the meeting and having options and adding fruit and veggies in, so people who are trying to be healthier can reach for that healthier choice. But it could also be really thinking about what other things impact the health. What benefits are we offering? Are we really helping our employees access the health care that they need? And this is where we start really thinking about what other groups in the workplace need to be involved in this effort. And so we're going to do those two things and really think about that in terms of we want to get to this place where we've done all we can to create worker well-being.
Thanks, Liz. And along that worker well-being, I'd really think about a time in your last few years that's been the hardest time for you around going to work. And maybe it was things related to work itself, right? All of those, everything from too much work, not clarity enough about work, maybe conflict between people, right? But sometimes it's things outside of our work, correct? And so I think in that create worker well-being along with grow health, sometimes it shows up in benefits. Sometimes it shows up other places as to those things that we assist people during those times that we might otherwise lose an employee, right? Which is not going to be good for the employee, and it's also not good for the organization. When we think about, and our HR folks could talk to us about how much money we lose in turnover and bringing new workers up to speed. So really, those are all those things that go into that kind of the evidence that supports why total worker health really not only is our future, but kind of pays for itself. And I am so sorry, Liz, but it looks like in this slide deck, we do not have the definition you don't like.
Oh no.
I don't think we do. So, but to be fair, Liz and I joke about this. So the formal NIOSH definition of total worker health is really where we talk about programs, policies, right? Those and practices, those three things that we all know as safety and health professionals. But we're expanding that view of what those hazards are. So we're going to use programs, policies, and practices to help create spaces that provide for the safety, health, and well-being of employees. And that, what's the rest of that definition, Liz?
Integration.
Integration
is really
yes,
key.
so we're really integrating both, that kind of recognizing a worker as somebody who also goes home and has other hours in the day and other things that both make us struggle more at work and maybe make us stronger at work, but also that integration within our organization. And for those of us at really large organizations, that can be really challenging sometimes, because we have a unit that does this, we have a unit that does this, we have a unit that does this. And so we really want to look for ways, and every organization is going to be different. Not that we always communicate about everything together, but we imagine how we can build these initiatives together so that they further those things, for sure. I think, though, yeah, that comes back, though, to the big question as to, well, if we do this, you know, why are we doing this? Like, why does work influence our health and well-being? And I would ask each of you that question. I keep talking on you, Liz. Go ahead.
It's okay. I think my connection's a little spotty, so it's hard for me to tell, or I'm lagging a little bit too. But I think for me, this is a really key question, because what I hear from some of, especially small and medium-sized businesses, is, wow, this sounds really overwhelming, and why is it my responsibility? It feels like maybe I'm getting into personal business of people when you tell me to really start thinking about their health and things like that. So if we think about it, though, this is a really key question. So how does work influence our health and well-being? And there's just so many ways, but I'd love to hear in the chat what y'all think. I keep saying here, but see, I guess, is more appropriate.
And it's certainly been interesting with COVID-19, because, you know, during the pandemic, many of us have heard or said that has made total worker health so clear to us in terms of why it matters, why it can be helpful. If you look at what employers have struggled with, what employees have struggled with, that tie between work and home, right? The challenges of that, but also what we can do to help workers feel safer being back at work, or the precautions that we take, or how we can limit the spread. All those things really do start to show that work tie-in between work and health.
Yeah, and Lee just popped in a very key component of how work influences our health and well-being, and that is we spend a lot of time at work, don't we? So what we experience at work has a great impact on our life. So it could be we're experiencing stress at work. Maybe we're exposed to chemicals at work. Maybe we have some ergonomic exposures at work, or maybe it's simply I don't really get along with my supervisor and coworker, and I don't feel supported at work, or I have too much overtime and I work long shifts, and so I don't have time to take care of my personal demands that really are important for me to feel like I'm taking care of as well. Work culture can permeate our home lives. That's so true. And I think the days when people believed you left work at work and you left home at home are pretty much gone. We know that just is not, we're not capable as human beings of drawing those hard lines. And so what's happening at home is influencing what's happening at work, and vice versa. And I do like that Jim has also said something very positive about how work can influence our work and health and well-being. So if we do have good relationships at work, and we do have supportive relationships at work, and we feel like our employer is taking care of the hazards and exposures that we might be exposed to, then work can very positively influence our health and well-being.
That's great. You took the words out of my mouth, Jim, because I think we do need to also consider that. Right, the positives that we can really gain. And you know, Liz and I have talked about, you know, there's a lot of people who are socially isolated. I mean, not just during COVID, but even prior to COVID, in their own homes and families and communities. You know, there was a study done not long ago showing the number of people prior to the pandemic that really didn't have, the number of close people in their lives was so low. And so we do know that for some people, our social support at work can be really important. And if that social support is negative, then that's a really even greater detriment on me. Are there some other things, Liz?
I think I gathered everything that's in the chat so far. If I see more stuff pop up, I'll break in.
I would have you thinking about, work certainly brings us benefits if we're lucky, right? Work, the wage we work at, absolutely influences our health and well-being. That influences how much free time we have, how much time we have to spend with family and friends, how much time we might have to find ways to exercise. And there's such a direct link, we know, with that as well.
So we talked about how work affects health and well-being, and I just wanted to really briefly touch on what we call in the public health world the social determinants of health, of which actually work is a social determinant of health. But here are a few other things in our communities that will impact our health. And one of the things that I find really striking about the United States is that your zip code, so in other words, your neighborhood and your built environment, have so much to do with your health outcomes. Longevity, risk of mental illness, risk of respiratory illness are really all tied to the location in which you live and work. And so it's very telling that and this is another thing about total worker health that is really appealing, at least for me, is that we do talk about how do workplaces make the connections with community. So again, we're looking at how do workplaces really help support these community conditions that affect the health of their workforce. One of the things we do know, and in terms of benefit for organizations, a healthier worker is not only a safer worker, a healthier worker is a more productive worker, a healthier worker will come back to work after a workplace injury more quickly. A healthier worker will also be less likely to leave an organization or have absent days or presenteeism days. So there's a lot of benefits for the organization in really working on building the health of the people that work there. So I'm not going to spend any more time on this slide, but you kind of get the idea that it's not just the workplace. We all live in these ecosystems that impact our health as well.
Thanks, Liz. So with worker well-being, this is, Liz already shared that this will spend more time on. We do spend more time on this in our other class. And the point is, we've been mentioning the term worker well-being, and we might have different ideas of what it exactly means, different ways to assess it. NIOSH recently came out with a new scale that organizations can use to assess well-being. And I think if you were asked, what does it mean when you're feeling well, your whole being is feeling well, we all can get some, maybe there aren't even words to that as to how you feel. But I think it's a very important concept. And it's one of the big things when we talk about total worker health. Think of the years we've talked about wellness, right? And, what we really do know is total worker health is different than the traditional wellness model that wasn't, and some wellness programs are more total worker health, but the traditional wellness that really looked at physical health and not necessarily all of the other aspects of well-being and health that we now know, or certainly we've probably always known, are so important to all of us. So one of the main parts of the class that hopefully some of you may join, or maybe some of you have taken, is looking at this document. This is a NIOSH document that came out quite a few years ago. Well, not that many years ago. I was fortunate enough to be on part of the editing team with some other centers. But the point is, we feel that it speaks pretty well to safety and health folks and risk folks, and even HR folks. And so there's 5 elements in here that we take time to, in fact, kind of not just uncover, but talk about examples, right? And so this document is really helpful in helping us kind of walk through those 5 things So kind of that's the second key point here is there are 5 things that are identified that any organization that is walking down the road towards total worker health is going to need to kind of take under their belt and think of how to do it best. And so leadership commitment, right, Liz?
Leadership commitment. And just for everyone's edification, I just put the link to that fundamentals document in the chat. So leadership commitment, again, this is pretty self-evident to those of us in the safety and health field. We know we need that commitment for at the higher level to get those resource allocations, the time to really get that vision so that you'll get people on board. But I also want to talk a little bit about how important managers and supervisors are to this, because we know they really direct the day-to-day work that people do. So if we can get our supervisors to be part of our total worker health approaches, then we're really going to start seeing some gains. So really working on convincing all levels of leadership and even thinking about our informal leadership that we have in our organizations.
Yeah, you can see that. Thanks, Liz, for sharing that. Lots of great details on that. Our second main element is designing work. I want to see if we have so, in designing work, we all kind of know this, right? We know the hierarchy of controls, but as we stated earlier, we are kind of expanding what we're imagining as the hazards that really can affect our ability to be safe and healthy and have higher levels of well-being while we're at work. And so we're taking that idea of hierarchy of controls, but we're expanding it to other hazards so that we'll talk about those a little bit too, if we have time. But that's the second key element, and probably something we spend more time on for sure than some of the other elements in our other class. And so you can all think about examples of hazards that, maybe, when we try to choose those priority controls, well, we might have multiple controls in place, right? Like we do with COVID, the layered controls. But still, the point is we're looking at things that are more likely to actually take away the hazard or reduce the hazard rather than the things we might consider to be kind of Band-Aids, which might be helpful, but only when you take care of the hazard at some higher level.
And this one is very key, and I will just say a couple things. One of the centers has a tool specifically designed to help you get engagement, and this is engagement of employees. So there's a number of ways you can do this, but as we all know, again, in the safety and health field, if you do not get employees and workers on board with what you are trying to accomplish, then it just is not going to happen. So when I say engaged, I mean engaged in not only identifying the problems and thinking about which issues you're going to tackle. And one of the things Dede and I both talk about is prioritizing. And maybe you start with one thing. So helping getting that engagement from the workers on identifying, well, what's the thing we're going to start with? And then, as we all know, again, they usually, our workers and employees have some good ideas, or at least a lot of ideas about how to solve that particular issue, that's the number one thing that is on their minds. So there's a number of ways to do this. I talk about at SAIF, we're having a lot of conversations about learning teams, but having that culture of learning in your workplace. You can use things like Lean, you can do root cause analysis. There's all kinds of different ways that you can engage your workforce in helping identify the issue you're going to take on and solutions for it.
Thanks. And recognizing this is really where different workplaces are different, right? Things that work in some places are not a priority or may not be successful in others, which is again why it's so important to engage our employees. The fourth element is confidentiality. And so we do find sometimes safety and health folks get nervous about total worker health because they think there's health data involved in some of the discussions. And we would just remind all of you that we are really going to rely on our organizational partners who have the expertise on what the various confidential medical records laws are. What this is not about that. We are not sharing personal data. We might be looking at trends and looking at group data when we have a large enough organization. But again, it's really important that we all understand this is not asking you or wanting you to go down a path of at all being involved in something that is confidential and not something that is within what your scope of work should be. And yet it's important. We have confidential things that come up, and we need to know how to best have our organization help people with those things.
Yeah, and I think that's particularly important as we talk about promoting health, and we might want to know, for example, what proportion of our workforce is dealing with chronic conditions or certain chronic conditions. So it is okay to know that. It's not okay necessarily to know which individuals are trying to manage chronic conditions. The other thing I like to talk about here is one way of getting that worker engagement, or even just getting an idea of how you're doing, is doing employee surveys. And it's really, really key to maintain confidentiality there, so that you are creating an atmosphere that people feel safe talking about their experience honestly, or sharing their experience honestly.
And so that example brings us to the fifth element, which is integration, which we have spoken about before. That's both really kind of integrating the various groups that we have within our workplace. The last example is a great example of how, our HR folks and our benefit folks need to all be part of this conversation. In a perfect world, we have maybe a steering committee, or we have teams together that are not trying to create excess workload or excess meetings, but where we can really tie together some things that we may not know enough about as we build these initiatives that do kind of further the well-being and health and safety of our employees. And it really depends on your organization. If you're really large versus small versus what your industry is, how this works best. And we definitely have seen some great examples of organizations that have moved ahead on this and what's worked for them. The kind of idea, the safety committees have been really active in some places as a way to, kind of help not just engage and get in safe manners, get concerns risen to the top, but being allowed to then further an initiative with support from other leaders. I'm skipping over this, Liz.
Okay, it's just evaluation, and y'all probably know how to do that.
So we know that there are absolutely some practices that probably many of your organizations already do that pay for themselves in essence. They pay for themselves in terms of ROI or value of investment. Healthy supervision is certainly one that Liz has spoken about. We know paid sick leave does that, and there's a lot of evidence about that. One of the things that seems a lot of folks may find more difficult to imagine is the flexibility and control of schedule, but we know that is such a strong positive practice, both for keeping employees, for reducing stress levels, and often for increasing performance. And yet it doesn't, it doesn't mean you just flat out say, come to work when you want and work when you want, right? So I think there's a lot of great development on that. And the other two you can see as well. I know that many of you, I know SAIF has been a big proponent of active meetings, and I know many other organizations are as well, and the importance of friendly workspaces and, ergonomically friendly, but, age-friendly workspaces as well, as we want our spaces to be protective for everybody.
And I just wanted to pop back in, and I've added some links into the chat to Your Work Path, which is the center's website that talks about the toolkits and how to engage with the Oregon Healthy Workforce Center. And then a couple of links from SAIF, one to our leadership series where we have partnered with OHSU and have the SHIP training, which is a supportive supervision training there. And also our page on integrating health and safety. And there's just some more resources there so that you guys can go explore on your own. One of the things that I wanted to add about the flexible and control of schedule is that this COVID world has really highlighted how important that is, whether you were an essential worker that never worked from home because that just wasn't going to be an option for you. And then you're wrestling with things like childcare or elder care or schooling for your child who now doesn't have a physical school to go to for a while, to people who are working at home and trying to juggle, well, now my child is here and I'm trying to work as well. And so just one really quick example, I was talking to somebody earlier this week who worked out a schedule with their partner where they worked several hours in the morning and the partner was watching their young child, and then the partner would work in the afternoon, and they would work work with their young child, and in the evenings they would try to make up those times. Now that they were both working from home because that was the arrangement with their organizations, but just think how impactful that was for that particular couple who was trying to raise a child and did not during that time period have child care. They were still able to get their work done, but they had control over when they did that work.
Yeah, thanks, Liz. Definitely creativity comes in here and the recognition that this isn't, not all workspaces are really providing that right now. And that's another challenge. The last part of what we will do in other classes and just to be aware of is what we really, so many of us learn the most from is hearing from others, hearing from other examples. That's why in the classes Liz and I teach, we've learned it's really great when people come from different organizations because there's so much more sharing than if you all are aware of what your own organization is doing. And so we have certainly a number of case studies we've shared and some of them are representative of, many in Oregon. Bend Police Department that's done some work. We share some work that City of Eugene has done in some vineyards. And so really, it's really great to start looking at examples because we see how varied they are and how it can be what seems like a small thing. And it can start to build to something more. And whether we start at the top with a big program rollout from a policy and what's the word I'm looking at? A mission, which some organizations do, or starting in other places where we've got something that we're like piloting and we want to run with it and then roll it out. I guess, Liz, I'm sorry, Jim, I'm not sure, are we kind of winding up? Do we have time for a couple questions?
Yeah, we have time for questions. So we'll wind up at kind of 1 o'clock. So we got.
Okay, perfect.
Oh, okay. I thought we were done at 12:55. So
Liz was pushing me. No, I'm kidding. So
I was. I had the wrong idea in my head.
Liz, do you want to say anything about this before I get off this slide?
Yeah, what I actually think about what's happening in the real world is you mentioned creativity, but what I am loving about what I'm seeing about organizations that are even just barely starting to dip their toe into this is that they are we have this issue to solve and we're going to pull from these different parts of our organization and really talk about how do we solve this one particular issue. And what I'm seeing when I work with organizations is definitely not that it's like, okay, we're going to focus on safety and health. Oh no, we have this hazard, but we're also going to talk about how to not only do we control this hazards, but how do we support employees? Maybe they need some nutritional support. So, I know, for example, there's some ag companies that are providing fresh fruits and veggies for their workers because they don't have time during harvest season, for example, to go find those on their own, or, you know, whatever it is, they're in a somewhat of a fresh produce desert. So, you know, it's really just thinking about how do we ask our employees and think about what our employees are struggling with and how we can support them. And organizations are being very creative. And I think Bend Police Department was a great example of that, because they did do that research into what's really going on with our workforce. And then we're going to try it out for 6 months, and then we'll keep the pieces that worked.
Yeah, I think that's great. I'm going to go ahead and get rid of the slides if that's okay with everybody, so I can see people. But I wanted to add to that. I think the last point you made, Liz, is so great, because what we do know, and we know this deep in our hearts, whether we've seen it or not, is when we trust our, not just our work colleagues, but our organizations, you know, it really does create a space that feels different. And when we are asked for input, we know this with safety. Well, when we're asked for input with even larger life issues, and we're shown that someone cares, it's huge. And we can't measure that always. We can measure that on a well-being scale. We can measure things like that on surveys. But I just would kind of continue to remind yourself what you know in your gut, which is, you know, that makes a difference at work. And not everybody wants the same thing. Not everybody, you know, but there are some very basics that humans do want and need. And I think we can try to think about that. And I'm getting quite touchy-feely, I realize that. But I really believe that more and more. You know, walk through COVID, watch listen to people and how hard this has been and what's been supportive and not supportive. And that is the future of work.
And Dede, I just want to really reinforce that, because I am working with a particular organization right now, and we were working with a really difficult workplace violence issue with them. And one of the things that this employee group that I've been working on has decided to really focus on is how the organization can make employees in that situation feel more valued, because one of the things they really want to see is that employee sense of value, retention, and longevity improve as part of this initiative that they're working on.
Yeah, I think, and you know, it really does get tied into employment. And are you an employer that people want to go to? And unfortunately, that's not. We have still many jobs that, people are trying to get whatever job they can, and it may not be their ideal job. But I think for all organizations, it's becoming increasingly important that we have spaces that the workforce that we desire wants to stay at. Yes. So thank you all for being here today and for inviting us. Liz is, well, I'm sorry, I'm not sharing confidential data.
It's okay. It's not that confidential. I've been telling everybody.
Liz is in her second shot day after, so she did great.
I was a little worried I'd be incoherent because I am feeling it.
So I don't know. Thank you, Jim. And I know you all can sign up if you want. I sound like I'm selling a product here. I guess I am. But there will be other chapters that are also doing the 101. And we're always looking for other organizations that might want to go ahead and help us get that out, because we really believe it's the basic building block for, in fact, having organizations adopt and move ahead with total worker health. And then I guess I would say we also have started some meetups. So once folks have had the 101 class, they are invited to a quarterly meetup, which is just an informal discussion with Liz and I, where we can share newer things, and folks can also share kind of what they're working on or what they're struggling with. And we have, oh my gosh, it's this week. We have our second one on Thursday. I almost forgot. Yeah, great.
Well, thank you, Liz and Dede, so much for your presentation today. And again, we'll be sending out the link for the recording, and it will have the resource, I think, Liz, that you emailed to Christy and I, and we will also include a link to the description and the registration for the May 12th event. I really appreciate both of your times today. So thank you all so much, and thanks everybody for coming and participating in the chat. I know kind of we're at time, and so I'm trying to remember. I don't have it right in front of me. Dennis, maybe you do, of our topic for our next monthly meeting.
I believe it's our interns.
It is. It's our OSU interns coming to share their projects with us. So join us in May.
That sounds fun.
It's my favorite of the year.
Thank you all so much. Have a great rest of the afternoon.
Thank you.